Plans for effective global drug control. Global drug control is a complicated issue due to involvement of international agreements, national laws, and different strategies based at checking the production, trafficking, and use of illicit substances. Key aspects are international framework, United Nations conventions. The core issues of global drug control depends on three key UN conventions as the single convention held on narcotic drugs, second on psychotropic substances, and third against illicit traffic in narcotic drugs and psychotropic substances during 1961, 1971, and 1988 respectively. These conventions develop in a framework for countries to check the production, distribution, and use of certain drugs and to cooperate in controlling illicit trafficking. International Narcotics Control Board. The INCB is an independent quasi-judicial monitoring body. Time to time, the implementation of the decision taken in the UN Drug Control Conventions. It works in cooperation with the government to ensure comply with their obligations and to protect the diversion of controlled substances into illicit channels. United Nations Office on Drug and Crime, the UNODC works in coordinating international efforts to control drug trafficking and related crime. It gives required help to countries in developing and implementing drug control policies. World Health Organization, the WHO works in supplying the scientific evidence about drugs and their impacts on health to the CND and also provides guidance about the treatment of drugs use disorder. National strategies. Law enforcement. National government utilize law enforcement agencies to control drug trafficking, arrest drug dealers, and seize illicit substances. Border control. Efforts made to combat drug trafficking and play a role in strengthening border security to protect the movement of illicit substances through national boundaries. Prevention program. The number of countries invest in drug prevention programs based to aware the public about the negative impacts of drug use and decreasing demand. Treatment and rehabilitation. Supply access to drug treatment, rehabilitation services as an important part of drug control strategy. Harm reduction strategy aim to decrease the negative result of drug use like the spread of infectious disease and overdose deaths. Legislature measures. National government develop and implement law that regulate the manufacture, sale, and storage of controlled substances. Challenges. The international drug trade is highly adaptable and traffickers often use new ways and methods to escape detection. Second, poverty, inequality, and political instability can provide conducive environment to drug production and trafficking. Third, the synthetic drugs provide new threats for law enforcement and public health. Fourth, maintain the balance of law enforcement efforts with the consideration of public health and human rights. It is essential to understand that the war on drugs is a topic in much discussion and with several different viewpoints on the most effective methods to consider the issue of global drug control. Thank you. Please subscribe, like, and comment.